Hi, I'm Dr. Melanie Crites-Bachert here with 360 Pelvic Health Institute, which is a division of the Center for Men's and Women's Urology. I want to talk to you a little bit today about treatments for bladder overactivity, which is commonly a situation that men and women experience where they run to the bathroom frequently. They feel the sudden urge to void. Sometimes they can't make it to the bathroom fast enough. And sometimes there are also situations where the bowels leak when the sudden urge hits and they can't make it to the restroom to have a bowel movement fast enough and end up soiling themselves. We also sometimes use sacral neuromodulation or interstim for treatment also of incomplete bladder emptying, which is the inability to completely void the urine from the bladder. So what I'd like to talk to you a little bit about today is actually what sacral neuromodulation is. It is a device, in simplest terms, that helps to regulate the nerve that controls the bladder and the bowels. It's a technology that's been around since 1997 to treat refractory, frequency, urgency, and urge incontinence. And when I say refractory, I mean that the typical treatments used to treat those symptoms are not effective, and we need something a little more aggressive. It's also been approved in April of 2011 to treat fecal incontinence. Very widely used technology and also very, very effective. I particularly enjoy a 91% success rate when used in proper patients. I'm also in the top 5% of implanters in the nation, so I'm very familiar with this device. I've been using it since 2005, and I have found it to be life-changing for a number of patients. So how I explain it to my patients is that it acts as a descrambler, meaning that when the brain sends the signal to the bladder or to the bowels, the nerves that control the bladder and the bowels don't process that signal properly. Therefore, we implant a small wire down in the S3, which is the sacral nerve foramen, which is where the nerves lie that control the bladder and the bowels. We place a small wire down alongside those nerves, and we hook it up to a battery, which then delivers continual stimulation. What that allows is for the signal that the brain sends to be processed normally by the bladder and the bowels. We do typically a 1-week trial for patients that are suffering from frequency and urgency and urge incontinence of urine, as well as bowel, and we typically do a 2-week or longer trial for patients that suffer from incomplete bladder emptying. Now, I'd like to show you some components of the device. This is the permanent wire that's placed once we decide and we have found that the device works properly and gives good benefit. How we measure good benefit is 50% or more improvement in symptoms. Now, quite honestly, most patients experience a much more dramatic response than 50%, which is a phenomenal statistic. Some patients also enjoy complete dryness or inability to stop needing to use catheters to empty their bladder. We do a typical 1-week trial for fecal incontinence, refractory frequency, and urgency, where we place a little temporary wire on each side of the sacrum alongside the nerve that control the bladder and the bowels. Those wires are then taped down to the back, and you wear a little belt around your waist underneath your clothing for a week. This is then wirelessly attached to a little device that is about the size of a cell phone that fits in your pocket. That essentially acts as an external battery that delivers continuous stimulation to those wires, allowing those wires to regulate the nerve that controls the bladder and the bowels. This is done under local anesthesia, which means just numbing up the area over the back, and we give you a little bit of sedation in an IV, basically the equivalent of Valium, so that pain is controlled, but you can still experience the sensations that we need you to experience when we test the device. The patient keeps those wires taped down to the back for a week, and then keeps a bladder or bowel diary or both during the duration of that week. The patient will then come back to the office a week later, and we will pull out the wires. At that point in time, we'll take a look at the patient's bladder diary or bowel diary, and we'll see if they've had more than a 50% improvement in symptoms. If they have, then you get to go on to have the full device implanted. We would schedule a time to go back and place the permanent wire. This is again what the permanent wire looks like. It lays right down underneath the bone alongside the nerve that controls the bladder and the bowels. This is the battery. The permanent battery fits right underneath the fleshy part of the patient's hip. We create a pocket right underneath the fat. And the wire connects to the battery underneath the skin. So a patient has basically no downtime, no wires sticking out of their skin or out of their back, and it doesn't prevent you from doing basically anything that you want to do. Of course, with the exception of very, very vigorous heavy exercise, which potentially could displace the lead. You can go through X-ray at the airport, typically given a little card that they will ask you for. You can show the little card to airport security, letting them know that you have a pacemaker device, and they can wand you. Also, you can have any series of scans, CTs, X-rays, PET scans, ultrasounds, mammograms are perfectly fine. You can even have an MRI of your head and neck. You just can't have an MRI of the rest of your body. Hopefully soon we will find that we can have an MRI of the rest of the body, but for right now, that's the basic contraindication. This device is not appropriate for those patients that require regular MRIs of the full body. I would love to tell you more about this device. I would love to show it to you in person. If you have problems with any of these conditions, let's see if Interstim can help you.